We shall start with Prasuti Tantra. The first part is anatomy. So it has been told that Purusha Uraha Pramana Vistirnaha Stri Shronihi Ashtadasha Anguli Vistira Uraha. So it is told that Purusha Uraha. Uraha means the chest dimension or the measurement of the Purusha, male. It is equivalent to the Stri Shroni, pelvis. Okay. So Ashtadasha Anguli Vistaram Uraha. So the dimension of the Ura of the Stri is Ashtadasha Anguli, that is 18 Angula. This reference is from Sushruta Sutra, 35th chapter. So in this shloka they have told that the Purusha Ura, it is equivalent to the Stri Shroni. So the dimension of the Stri Ura, okay, the female chest dimension is 18 Angulam. Okay, then coming to the female pelvis, according to Chakrapani, he has told 24 Angula, whereas whereas Sushruta and Dalhana and has told that 12 Angula. Even the rest other author also follow the 24 Angula. So the female pelvis is 24 Angula according to Chakrapani and other author. According to Sushruta, it is 12 Angula. And the female chest dimension, okay, Uraha is 18 Angula. So even in any MCQs, these two questions might be asked: the Angula Pramana of the Stri Shroni or the Stri Uraha Pramana. Number of bones in a pelvic cavity. The bones which are present in pelvic cavity are Kapalasti. Okay. Charaka has mentioned there are 3 bones in pelvic cavity, whereas Vagbata has told 4. Sushruta has mentioned 5. So Charaka in Sharirasthana 7th chapter, he tells Dve Shroni Falake Eka Bhaghasti. He has mentioned 3. So what are those 3? So Dve Shronita Falaka, Shroni Falaka and 1 Bhaghasti. So total it makes 3 according to Charaka. Whereas Vagbata has mentioned 4, he tells that Ekam Ekam or Ekaikam Bhaga Trike. So 1 1. So 1 Bhaga and Trika, they are 1 in number. Nitambeshu Dve. So Nitamba, that is a type of Asti, they are 2 in number. So totally it makes 4. The 4 Astis according to Vagbata present in the pelvic cavity are Bhaga, Trika and Dve Nitambeshu. Whereas Sushruta he has told the 5. श्रोण्य पञ्चाः तेषां गुदभगनितम्बेषुः चत्वारिः त्रिकसमाश्रितम् एकः. So he tells 4 are Gudabhaganitambeshu. So they are 4 in number, and the 1 Ekaha Trika Samashritaha. So Trika is 1 in number and Guda Bhaganitambeshu, they are 4 in number. So they total 5 asthis are present according to Acharya Sushruta. Now coming to the joint. Here it is told that 3 joints are present. The shloka is Trayaha Kati Kapaleshu. There are 3 joints present in the Kati Kapaleshu. So Ashtanga Sangraha, we get that Samudga. It is Guda Bhaga Nitambeshu Samudga. Guda Bhaga Nitamba. These 3 together has got the joint Sandhi, that is Samudga Sandhi. Whereas Kati Kapaleshu Tunna Sevani. Shiraha, you get a general reference, like there are 2 places where we get Tunna Sevani. Tunna Sevani is like a suture type of uh, this joint. Okay, especially it is present in 2 places. One is Shira and another one is Kati Kapaleshu. That is Tunna Sevani. So joints present in pelvis. There are 3. That is Trayaha Kati Kapaleshu. The one is Samudga and another one is Tunna Sevani. Samudga is according to Ashtanga Sangrahakara. Tunna Sevani is according to Ashtanga Sangrahakara only. Okay, while telling the Sandhis only, he has mentioned Samudga Tunna Sevani. Now coming to external genitalia. It is called as Bhaga, vulva. is considered as bhaga, and the dimension is 12 angula. Okay, so even the bhaga is 12 angula, and the female pelvis is 12 angula according to Sushrutacharya. Okay, the other name for external genitalia, they are bhaga shishnika, Smarata Patra, okay, Madhanata Patra, Smara Mandira. So this is other names or synonymous names, especially represents the clitoris. Now coming to the shape of the yoni. It has been told in Shruta Sharira that Shankanabi Akriti. It resembles like the shape of a conch, and it has got three avartam. Okay, Garbhashaya is having three avarta, and the Garbhashaya means Yoni is having three avarta. Garbhashaya is present in the third avarta. Okay, Shanka Nabhyakritir Yonis three avartasaha prakirtitaha. तस्याः तृतीयेः त्वा त्वावर्तेः त्वा आवर्तेः गर्भाशय प्रतिष्ठितः. So it has been told that in the third avarta garbhashaya is present. So in the pratama avarta, external genitalia area, that vagina comes. In second dvitiya avarta, cervix or external os comes. In tritiya avarta, uterus, internal os, fallopian tubes, ovaries, this all will come. So there are three avartas, Shankanabi Akriti. And even it is being told that Akriti, Garbhashaya is similar in shape and size as the mouth of Rohita Matsya. Okay, this is also an important question. Yoni Nadi, it has been mentioned by Bhava Prakasha. There are three in number, that is Samirana, Chandramsi and Gauri. So Samirana, the site where it is presented, it is present at the Madana Patra. So Madana Patra, here also you have learnt Madanata Patra. Okay, so it is called as clitoris. If the semen or Shukra falls at this Madana Patra, at the clitoris, it is Nishphala. Okay, means there is no chance of getting conceived. Whereas Chandramsi, it is called as Kandrapa Geha. Okay, it is called as mid-vaginal canal. If the semen or Shukra falls in the mid-vaginal canal, there is a chance of female kid. Whereas Gauri, it is Upastha Garbhaha. It is the place where the Garbha is present, and it is a deep vaginal canal. If semen or Shukra falls on this part, then there is a chance of male child. So even this Samirana, Chandramsi and Gauri, these are considered as Yoni Nadi. Okay. Now coming to the uterus. Uterus in Stri, it is considered as the eighth Ashaya. Synonymously, it is called as Dhara. It is told by Sharangadhar and Bhava Prakasha. Okay, and Sthana, it has been told that Pitta Pakvashaya or Madhyame. Pitta Pakvashaya Madhyama, it is present, or it is Madhyama. Especially they are telling when it is a gravid uterus. When a gravid uterus is there, usually it present in the Pakvashaya, that is Pitta Pakvashaya Anga, it becomes organ. Okay. Shape. In the modern, it is pear or pyriform shape. Weight is 45 to 55 grams. Dimension, length 7.5 centimeter, width 5 centimeter, thickness 2.5 centimeter. Okay, so this is also an important point. Okay, Abhyantara Srotas. There are two Srotas, two Artavaha Srotas. It has been told by Sushruta. Artavahe Dve. He always tells in the pair. So two Artavaha Srotas, Artavahe Dve. Tayor Moolam Garbhashaya Artavahinyascha Damanya. So the Moola of Artavaha is one is Garbhashaya and another one is Artavaha Damani. And the most important, Tatraha Vidyayam. Okay, if there is any injury to the Artavaha Srotas, what will happen? It will cause us Vandyatva, Maituna, Asahishnutva, Artava, Nashascha. This three is going to happen. One is Vandyatva, for infertility is going to happen. Maituna, Asahishnutva, that is dyspareunia will be there, and Artava, Nasha. Coming to the age classification. Age classification, it is especially confined to the female. Okay, the age classification in broad we had learnt in Bhala Roga, whereas in the Stri it is only confined to the female. Whereas we had learnt this Parashara's Smriti has told Gauri, it is 8 years, Rohini 9 years, Kanya 10th year, and Ataha Urdvaha Rajasvala. Gauri, it is a name. If a female kid is of 8 years old, then she is termed as Gauri. In 9-year-old, she is termed as Rohini. Kanya, it is called if the kid is 10 years. Ata Urdhva, the above 10-year female kid is considered as Rajasvala. Okay. Bhava Mishra has considered as Taruni till 32 years, Atiruda till 50 years, Vriddha after 50 years. Whereas Haritha, he has told Bala from 5 to 11 years. Okay, his definition usually the Bala is up to 1 year for other acharyas, but he has told 5 to 11 years, and Mudga 11 to 19 years, Prauda 28 years, Praglabha 41 years. Okay, so what kind of questions you will get from this part? For example, see, uh, according to uh, which acharyas, okay, this age has been divided. I have been stressing you most of the time that you will get definite one question from the Vayobheda, that is Balya, Madhyama and Jeerna. Okay, this age classification has been done like Bala, Madhyama and Jeerna by which author? Okay, it is according to Charaka. So this is very important. Balyavastha lasts for till how many years? Like according to Charaka and Vagbhata, the age limit for Madhyamavastha. So like that you will get questions. Like according to Harita, Yuva Avastha. Okay, remains up to. So what is the Yuva Avastha according to Harita? Okay, this is for this three. Whereas Harita, he has told up till 25 years. Okay, Haritha classifies age of female, Bala. Okay, see there are two questions. Haritha, Yuvavastha, it is 25. He has not mentioned here. But for Stri has made a special classification that is Bala, Mudga, Prauda and Praglabha. There he has told that he has considered as Bala up to till. What is the limit for the Bala? Okay. See, the options I have given is 8 years, 6 years, 5 years, and 11 years. The question is up to how many years it is called as Bala. So, it is very direct question, but the options are very confusing. So, such kind of questions you might get. According to Sushruta, the Vistara of Uras in female, I had told you, you will get question in the both the aspect. They have told Vistara of Uras in female. Okay, we don't need while talking Prasuti Tantra, it is not required, but it is mentioned, and even in multiple choice they can ask 8 angula. Okay, uh, Shroni enumerated by Sushruta. Okay, these are the Shroni. How many Shronis he has mentioned? He has mentioned 5. Okay, and the size of Bhaga. Bhaga is the Valva. What is the size? It is 12 angula. Okay, that has been asked, and also they have asked Samirana, Chandramukha, and Gauri. What are those? We had learned that those are Yoni Nadi. So, like this, you can get questions, okay? Which is the eighth Ashaya in the Stri, that is the uterus. So, like this, you will get questions. I am telling you again, don't miss this Vayobheda. Okay, since there is a negative marking, so there are some topics you have to be very perfect. So, the one of the most important topic is this Vayo classification. Okay, Now coming to Shukravaha Sroto Mula, that is also important. Charaka has told Vrishana and Shefa, Sushruta has told Stana and Vrishana, and Astanga Sangraha has told Stana, Mushka and Macha. Formation of Artava from Rasa, Charaka, Sushruta and Astanga Hridaya have considered that Artava is formed from the Rasa Dhatu as a Upadhatu. Sorry. Whereas Ashtanga Sangrahakaram opines that Artava it is blood. So it is originated from blood itself. So Ashtanga Sangrahakara has opined that Artava originates from the blood only. So Sangraha, so Rakta, that you can remember. From Ahara Rasa, Arunadatta has opined, and menarche in the modern, it has been in the starting of the menstruation in a female. It is considered as menarche, that is 12 years. Menopause, the cessation of the menstruation in the women, approximately 45 to 50 years. Okay, the pramana of the Artava is 4 Anjali. Now, Rajasrava Kala, the days of bleeding phase, for how many days will be there? Ashtanga, Sangra and Hridaya both have opined there will be for 3 days, whereas Charaka has opined for 5 days Srava will be there. Okay, Rajasrava Charya. Okay, while at the time of bleeding, while menstruating, what regimens has to be followed? It has been told by Ashtanga Hridayakara in Sharira Sthana. Mruja Alankara Rahita. Mruja means the female should not take bath. Okay, and Alankara Rahita. No any ornament should be worn. Darbha Samastra Shaini. Darbha Samstra Shaini means she should sleep on the darbha, okay, on a mat which is made of darbha. And she should be on Kshaireyam Yavakam. Okay, we will learn what is Kshairaya and Yavaka. That is a type of food. And eat. How she is supposed to fed? Pranay means she should be fed with any kind of leaves. Sharave in any kind of earthen pot. It should not be broken. So Sharave haste or in the palms. And even she should fall brahmachari. She should not indulge in any kind of maituna. So Sushruta Sharira, we get that she should be fed with Havishya. Havishya means meal made of ghee, shali, that Shashtika shali and the milk. Okay, that is rice cooked with milk and ghee. That is called as Havishya or Yavaka. Yavaka is a meal made of barley and a milk. So that is called as Kshairayam Yavakam. Means Yavaka means Kshairayam milk, Kshira, milk cooked with Yavaka, Yava or barley. And the most contraindicated procedure during Rajasvala Kala is Nasya. Nasya should not be done. Okay, most of the Panchakarma is contraindicated, but highly contraindicated is Nasya. Shuddha Artava. So the Lakshana of a Shuddha Artava, according to Charaka, has told Gunja Phala Savarnam. Gunja Phala. It looks like the Gunja. Okay. Padma Laktaka Sanniba. It looks like the red lotus. Or Indra Gopaka Samaschaha. Indra Gopa, it is a insect. Okay. Indra Gopa is an insect. It is red in color. The Shuddha Artava resembles of these three articles. Whereas Sushruta, Ashtanga Hridaya and Sangraha have told Shasha Asruk Pratima. It looks like the blood of the rabbit. Laksha Rasopama. It resembles the Laksha Rasa. Okay. Ritukala. Ashtanga Hridayakara has told that it is last for 12 nights. Uh, it is 12th and 16th or 1 month. On 16th day, it is called as Ritukala. There is a difference between Ritusrava and Ritukala. Okay, that I will tell you in the next part. So 12th night is considered as Ritukala according to Ashtanga Hridaya, 12th to 16th, or 1 month Ashtanga Sangraha, 16 days from Bhava Mishra. So it is told that 12 days is for Brahmini, 11 days. This is the reference from Kashyapa. This type of classification is done by Kashyapa. So Brahmini, these are the um, community has been categorized. We all know Brahmana, Kshatriya, Vaishyas, and Shudras. Okay, so these are the division of the caste. Okay, so Brahmini, this three who is belongs to that community, it is 12 days. For Kshatriya Stri, it is 11 days. For Vaishya Stri, it is 10 days. Whereas 9 days for Shudra Stri. This reference is from Kashyapa Samhita. Okay, Rutumati. Okay, there is Rajasvala is different. Rutumati you can correlate to the ovulation phase. So how she will be Kshama Prasanna means she will be very pleasant. Okay, she will be she will be looking very beautiful. That is Kshama Prasanna. Even she will be Prasanna means she will be very happy. Okay, Sprurana in Shroni and Payodaraha. Sprurana means there will be some kind of pulsation, okay, in the Shroni Bhaga. Srashta, Akshi and Kukshi. Okay. Pumsakama, there is a desire for the meal. Okay, it is Pumsakama Pada has been used by Ashtanga Hridyakara. Narakama as from Sushruta. Priya uh, Priyakhada means she is desiring for the love. Again, it has been used by the Sushruta. No Kshara and Vamana for the Ritumati. During ovulation period, Vamana and Kshara karma is contraindicated. Rajasrava Kala. So there's a difference between Rajasrava Kala is considered as menstrual phase, Rutukala. So Rutukala, Rutumati. So this is called as Rutukala, ovulation phase. So it is a proliferative phase plus ovulation. It is last up to 12 to 16 days. Okay. Or it will start from the 12th day. If we take a 28th day of a month, it will start from Rutu Kala. Means it is a secretory phase. That is from where 9th or 13th day. Okay. Rajasrava Kala, menstrual phase. This phase is Vata dominant. Okay. Rajasrava, that is a bleeding phase. Okay, menstrual phase. It is a Vata dominating phase. Duration of Rajasrava according to different Acharya, Charaka has told 5 days, Vagbata 3 days, Harita has considered for 7 days. Okay, Bhava Mishra, he has told excessive flow. If it is there, then it will be last for 3 days. Then medium flow, it is there, then it will last for 5 days. Scanty flow, then it is for 16 days. It's a unique classification by Bhava Mishra. Now coming to proper age for marriage. Sushruta has told that 25 years is the age for male. For girls, it is 16, whereas Ashtanga Sangraha for male it is 21 years, for girl it is 12 years. And age for conception. Sushruta opines the same. He opines that marriage and the conception age is same. For male it is 25, for female 16, whereas Ashtanga Hridyakara he tells Sangrahakara he tells that for the male the conception age is 25, for girls it is 16. Whereas Ashtanga Hridaya, he tells that for man it is 20 and girl it is 16. Again, this part is also an important question. Okay, the age for conception and the age for marriage. From here also you can expect questions. And Garbha Sambhava Samagri. So the Samagri, which is required for the Garbha Utpatti, that is Ritu, Kshetra, Ambu, Bija. It is four. It is accepted by Sushruta and even Kashyapa also has accepted. But Kashyapa he tells that Bija and Ritukala. He considers these two, but even he has classified Ritu, Kshetra, Ambu, Bija. Whereas Ashtanga Hridaya, even he considers the fourth, four also, Ritu, Kshetra, Ambu, Bija, but even he includes other two. Those are Marga and Hridaya. These two are also required for the Garbha. And Charaka also opines the same. Marga, Hridi, Ritukshetra, Ambubija. Means all author have they have to accepted that Ritukshetra, Ambubija, but they have added two more features which are essential for Garbha Sambhava. And he has told that on which day Maithuna has to be done. Okay. Yugmeshu putraha ayugmeshu stri. It has been told by Kashyapa. Yugmeshu. Yugmeshu here it refers to the even days. Okay. On the fourth day, sixth, eighth, 10th, 12th. So these are considered as the even day. On these days, if Maithuna has been done, that is sexual intercourse is done, then it will lead to the janana of a male fetus. If on the odd day, that is 5, 7, 9, then it will lead to the janana of a stri, female kid. Okay. Ekadashi and Trayodashi excluded by Ashtanga Sangrahakara. So see, in both the Yugmesha, Ayugmeshu, 11 and 13 is excluded. So according to Ashtanga Sangrahakara, on that day, on the 11th day and 13th day, Maithuna should not be done, because if it is done also, it will lead to Napumsaka. But Sushruta opines only 13th day is considered as Nindita. On 13th day, Maithuna should not be done. Whereas Ashtanga Hridaya, he tells Ekadashi is Nindita. Here Sangrahakara opines both. Ekadashi 11th and 13th day. Sushruta only accepts 13th day should not be done. Ashtanga Hridayakara opines on the 11th day should not be done. See, for a easy way of remembering, 11. Okay, it is a two horizontal line. So Hridayakara, when we see H, you can see two horizontal lines. So easily you can remember. If that question is asked, which day is not considered for Maithuna? On which day, if Maithuna is done, it will lead to Napumsaka, or it is considered as Ashubha according to Ashtanga Hridaya. So it's on 11th day. So when you remember H and 11, the other rest you can remember. Okay. So this is a way of remembering few of the concepts or few of the point. And Charaka and Kashyapa has mentioned Putreshti Yagna. Okay, you can perform Yagna for the purpose of getting a progeny. Preconceptional preparation. So for the preconceptional preparation before the Maithuna, what preparation has to be done? For males, Kshira and Ghee and Kalyanakam. Okay. Kalyanaka Gruta can be given and Kshira can be given. For female, Taila. We all know Taila is a Yoni Shuddhikara. Okay, it does the Yoni Shodhana. That is why in a Stri, Taila is preferred and Masha is preferred and Phalasarpi is given. Okay, even Gruta is Shukrala. Okay, it instantly increases the Shukra. So this is way in this way you can remember Taila because it is Yoni Shodhaka. Hence with the Taila and Masha it is given. Grita it is a Shukrala. And Kshira is also Shukrala. Now coming to the embryology. Okay, Garbha, the definition of Garbha according to different authors. Shukra Shonita Jiva Samyogetu Kalu Kukshi Gatehe. So Shukra Shonita Samyoga. That is the union of Shukra and Shonita Kukshi Gataha, present in the Kukshi. Shukra Shonita Garbhashrayasta Matma Prakriti. Here Kukshi he is referring to the Garbha. So Sushruta he gives the word Garbha only. Shukra Shonita Garbhashrayasta Matma Prakriti should also be there. For the Utpatti of the Garbha, Shukra Shonita is not enough. Along with that, Atma Prakriti is also important. Sudaye Shukratave Sattvasva Karmaha. It is according to Ashtanga Hridaya. That is Shukra and Artava Sattva. All these are included. Now coming to the Panchamahabhuta, the effect of Panchamahabhuta on the Garbha. This has been told by Charaka Sutra and Vagbata. This we give this Panchamahabhuta on Garbha. It has been explained by all the Acharya in Sharirasthana. Okay, if Akasha Mahabhuta is there, it leads to Mukha, Kanta, Koshta, Mana, Buddhi, Nindra, Alasya, and Mada. Okay, see Mana, Buddhi, Nidra, Alasya, Mada, it has been told by Harita. By Akasha Mahabhuta only, these all features get expressed. Vayu. Here, Vayu, he has told Prana, Apana by Kashyapa, Karana, Sveda, Chankramana. Okay, Chankramana means ability to walk. This is only possible by the Vayu. Karana, Sveda, Chankramana, it is told by Harita. Agni, Medha. Okay, that is Ashtanga Sangraha. Sharira Vriddhi. Agni is responsible for the Vriddhi of the Sharira, as told by Kashyapa. Tamas and Krodha. Because of Agni only, the person will have Tamas and Krodha. It's been told by Harita. Jala, Sveda, Ashtanga Sangraha. Mamsa has been told by Kashyapa. Lala, that is the saliva or any kind of a liquid. Uh, uh, Tissue. Okay, liquid content in the body is by Harita. Prithvi, it is responsible for Dhairya. This has been mentioned by Bhagavata. Function of Panchamahabhuta in Garbha. What this Panchamahabhuta does in the Utpatti of a Garbha. Vayu vibhajati, tejayena pachati, aap kledayati, prithvi samhanati, akasham vivardayati. So, Vayu vibhajati, vibhajana, it divides. Teja pachati, it does all kind of metabolism. Aap kledayati, aap it gives the moisture. Prithvi samhanati, it gives the compactness or it gives solidify, it gives compactness to the all the structure from cell to the organ, it gives the structure. Akasha vivardayati, vivardana means it increases the size. So now coming to the placenta. Placenta, it is also called as apara. Apara is another name for, the apara is the word given for placenta by Sushruta. Apara and Jarayu, this both term has been used by Sangraha. Garbha Dharini by Charaka. Garbha Poshana. So why Garbha Poshana is required? The essential of Garbha Poshana is Matu Poshanatham, for the Poshana, for the nourishment of the mother. Garbha Pushti, not only for the mother, even for the portion of the Garbha. Stana Pushti. Stana Pushti means even for the uh, manufacture, sorry, even for the production of the stanya, this garbha poshana is required. Upasneha, upasveda, tena nabinadi. He has given this three terms. Upasneha, upasveda, nabinadi. It has been mentioned by Charaka. So these three are phases of garbha poshana. So what is upasneha? Upasneha means absorption. Upasveda, okay, histotrophic transfer, like post implantation. Okay, post fertilization, upasveda is post implantation. Then nabi nadi, hemotropic transfer. Okay, then there will be a transfer post implantation. There's a formation of the blood nadi, nabi nadi, means placenta for the to establish the circulation. So that those are the three phases of garbha poshana: upasneha, upasveda, and nabi nadi. Okay, upasneha by tiryagata dhamanis, and is mentioned by Sushruta plus nabi nadi. These two are required. Sushruta has mentioned, he has not mentioned upasveda. Okay, Sushruta has mentioned upasneha, nabi nadi, and he has told that how this upasneha is going to happen with the via tiryagata dhamanis. Upasneha, upasveda, nabi nadi reaches pakvashaya and with its kayagni. Like this explanation has been given by Sangrahakara. Okay, and Ashtanga Hridaya and Boja, they have accepted that this Garbha Poshana happens by the Kedara Kulya Nyaya. Now coming to the month-wise development of a fetus. This has been mentioned by Ashtanga, Hridaya, Sushruta and Charaka. Haritha, he tells that they all have told, okay, month-wise development, but Harita has told day-wise development. Okay, Sharirasthana, you can refer that. They are all similar. Okay, I have not mentioned the month-wise development according to these three acharyas. The most important and unique one is Harita. Okay, day one, there will be formation of Kalala. Kalalavat will be there. Okay, on the 10th day, Budbuda. Budbuda means like a morula. Okay, means there will be small bubble like structure will be there. 15th ghana, it becomes like a moss. Okay, 20th day mamsa pinda. Okay, then it becomes like a mamsavat pinda, like a muscle mass it looks. On 25th day pancha bhutam sambhava, there is a sambhava means there's a formation or there's an influence of panchamahabhuta on the 25th day. So you can remember 25th 5 panchamahabhuta will be there. Now coming to the first month, there will be formation of pinda. 50th day. Okay, ankuranam sambhava. Ankura means like a sprout, means you can see some kind of sprouting in this pindi swarupa of the garbha. On the third month, Hastapada, there will be formation of the upper extremities and the lower extremities. And in the 3.5 month, Shiras becomes Saratva. Okay, in the Shiras, there will be formation of the Sara. Okay, on the fourth month, Lomanam Sambhava, there will be formation of the hair follicles. Fifth month, Sujivat. Sujivitaha, there will be life, means you can he's telling that you can appreciate the movement of the fetus. Sixth month, praspurana. Fifth month, sorry, in the sixth month you can feel the pulsation. Okay, on the eighth month, agni, there will be formation of agni, means the digestive system of the baby will be formed. On ninth day, chestotpatti, means any kind of movement will be there. Prasparana, Sujivitaha means he is tell that at the time it becomes alive. They are telling means there will be some type of movement. Chetotpatti is you can feel the fetus moving. So Kashyapa, he has told a unique way of organ formation. He has told that first there will be formation of Shonita. From Shonita, Hridaya will form. From Hridaya, Yakrit will form. From Yakrit, Pliha will form. From Pliha, Puppusa is going to form. So this is a unique way of organ formation told by Kashyapa. Now multiple pregnancy. So, like a twin pregnancy or triplets, quadruplets, why it is going to form? He is told that Ati Pravruddha Vayu. If Ati Pravruddha Vayu is there, that is responsible for multiple pregnancy. This has been told by Charaka. बीजो अंतः वायुनां भिन्नो द्वो जीवोः कुक्षि आगताः. Sushrita, he tells that bija antah vayu, the vayu present inside the bija. Okay, because of that there will be bhinna, division into a two. So two jiva, it divides into two jiva in the kukshi. Vayu divides at the stage of kalala. It is told by Bela, because of the Vayu at the stage of Kalala, there will be a chance of getting a multiple pregnancy. Intrauterine stay of a fetus. Urdha Shirsha. Urdha Shirsha means just like in an upright position, the kid will be there. This has been told by Charaka. Rest all Avak Shirsha. Avak Shirsha means upside down. Urdha Shirsha is breech position has been accepted by Charaka. He's told that is how a fetus will be there. Whereas Avak Shirsha means upside down, the fetus will be there has been accepted by rest other authors. So while talking in the modern, it is both the way. Okay, the till sixth or seventh month, the kid will be in the upside, like urdhva shira. It will be in the breech. Then after seventh or eighth month, it turns upside down. Avakshir and takes the vertex position. If Dakshina Parshva, Okay, when we do per abdominal examination of pregnant lady, if dakshina on the right side, if you see the parshva, okay, parshva or the back, it is considered as puman, male kid. Vama on the left side, if you're able to feel the back, then it is considered as stree. If it is present in the middle, then it is considered as napumsaka. Now coming to Pumsavana Karma. In a clinical aspect, Pumsavana Karma is it is prohibited. Okay, it is not practiced, it's considered as illegal. And in Ayurveda, it comes under PCPNDT Act 1994. What is PCPNDT? The full form is Preconception, Prenatal Diagnosis technique. Okay, diagnosis technique under this act, this pumsavana karma even comes, so it is prohibited, it should not be practiced, but for examination purpose we should know some of the points. It is also called as Vivartana Samskara. This word has been used by Acharya Charaka, that is Vivartana Samskara. That is, he has told Prag Vyaktehe Bhavat. Prag Vyakte Bhavat means before the Vyakta of the Bhava. Uh, Here, Vyakta, he specifically tells, he is quoting the Vyakta of the Linga, okay, before the gender forms in the fetus, you are supposed to do Pumsavana Karma. That is the Pravyakta Bhava. Bhava is nothing but gender or the Linga of the Shishu. So before that only you are supposed to do Pumsavana Karma. So he has told second month in Chakrapani commentary. It tells that the which month you are supposed to do is second month. Same thing has been told by Ashtanga Hridayakara, but he is told that Purva Vyaktehe Prayunjayit. Even he has also mentioned that Purva Vyakta before the expression of the gender you are supposed to follow. The month is first month. Labda Garbhehe. So as soon as the Garbha is getting formed, up to third month you can practice or perform Bhumsavana Karma. There is a yoga, okay, very uniquely mentioned in Charaka itself, Pushya. Whatever the yogas mentioned by Charaka, he has told that it has to be done on Pushya Nakshatra only. Okay, so that is Pushya. Purushakam Haimam. It is not a continuation of the shloka, it's in a tits and bits form. Okay. So here, Pushya, they are telling usually Pushya Nakshatraha. Purushakam Haimaha. Purushakam is telling that you should make a idol of a male kid. Okay, like a small male idol has to be done in gold or in silver or in iron. In this three metals, you're supposed to make a idol of a male. Then tasyaha anjali pibet. So what he has told, you have to heat it. Okay, heat it till it attains the agni varna. It becomes red hot. It has to be dipped in the milk. Okay, this gold, silver, and iron metal made in the shape of a male person has to be heated till red hot and dipped in the milk, and it has to be drinked in Anjali Pibet. In one Anjali Pramana, it has to be taken in which nakshatra? In Pushya Nakshatra. Okay, and who has to consume? Female has to consume. What all Pumsavana Karma is there? It is only for the females, not for the males. And even other drugs he has told. Gaura, Dandam, Apamargam. Apamarga, which is white in color, can be used. Kshirena Shvetaha Bruhati Moolam. Shveta Bruhati Moola, Kshira Prayoga can be done. Payasa Lakshmana Moola, then the milk processed by Lakshmana Moola can be given. Nasya Karma has to be done. Especially Vata Ankura is taken and it is installed on the right nostril. Okay, if it is installed on the right nostril, then alone there will be a chances of getting a male child. And this Nasya Karma should not be spit. Usually, Nasya Karma, the procedure is after installing whatever the mala gets accumulated in the mouth has to be spit, but it is not to be spit in Pumsavana Karma. Sushruta, as mentioned in the Bindu, 3 or 4 Bindu, Lakshmana, Vata, Shunga, Sushruta and Ashtanga Sangrakara have told. Lakshmana Mula, Kalka has to be taken in the matra of Udumbara matra with paya, milk, has to be taken, especially in the Sharad Ritu. This reference is from Ashtanga Sangraha. Now coming to the obstetrics, that is the conception and the delivery. Sadhya Grihita Lakshana, Sadhya Garbha Grihita Lakshana means if the fertilization is happened, what symptoms the female is going to express. It has been told in Charaka Sharira and Sushruta Sharira. Charaka Sharira second chapter, we get that Nistivika, excessive salivation will be there, Gaurava heaviness, Angasada malaise, Tandra drowsiness, Praharsha horripilation, Hridaya Vyata palpitation, Tripti containment. Okay, means she will not feel any kind of hunger. Always she feel that she is full. Bija Grahanam. Bija Grahanam means the retention of the Shukra and the Shonita is there. So the very unique, all Acharyas have mentioned the same. The extra point from the Charaka is Nishtivika. Nishtivika means excessive salivation will be there. The Sakti Sadhana, Yoni Spurana. Sakti Sadhana means some kind of tremors will be present, some kind of weakness in the thigh region, and Yoni Spurana, pulsation in the Yoni Bhaga. This 2 point has been mentioned by Sushruta. Now, Vyakta Garbha Lakshana means this is the Sadhyo Gruhita Lakshana is the fertilization, that tells the time of fertilization. Vyakta Garbha means it tells the implantation, the embryo has been implanted. If that has been implanted, what lakshanas the woman is going to express. For example, Charaka, it has been told by Charaka Sharira and Sushruta Sharira. He tells that Krishna Oshtatva means there will be blackishness of the lips. Romaraji Prakashanam, there will be excessive growth of the body hair. Oshtastana Mandalayoho Karshnim. Charaka tells that Oshta, lips, and Stana Mandala, Arula will be black in color. Yonischaha, Adalatvaha, Vivrutatvaha means in Yonischa you can feel some kind of dilation or some kind of pulsation. This has been told by Charaka. So Garbhalinga Dyotaka Lakshana means this is going to tell what type of fetus is present. Okay. Urdhva Romaraji. If the Romarajis are in the direction of the Urdhva, then it indicates there possibility of a male child present. Month wise, Charaka Sharira and Sushruta Sharira, change of Garbini has been told. And in Dhaurada, Charaka has considered a third month the female will be having Dhaurada, whereas Sushruta considered as the fourth month as the Dhaurada. Dhaurada, it's a condition, means a human being has having a two heart. That is the female has own heart and the heart of fetus. So Dhaurada is a condition since the baby is start to express, even the mother will start to express for the food. Okay, if that food is not given, then it is going to hinder the growth of the fetus. So that is the importance of Dhaurada. Now coming to antenatal care month-wise diets. So Charaka, Sushruta, Harita. On first month, Charaka has told milk. Sushruta Harita has not mentioned anything. On second month, Madhura Aushadha Prayoga has to be done according to Charaka. Sushruta has not mentioned, whereas Harita, Kakoli with Payasa is given. And third, honey and Grita. Sushrita, he has not mentioned any diet for first and second month. He has mentioned from third month. Shashtika Shali with Paya should be given, whereas Harita has mentioned Krushara. Krushara is nothing but a khichdi type of preparation. Charaka, Navanita should be given on fourth month. Sushrita, Mamsa, Rasa, Harita, Krutanna or Kruta Odara. Krutanna is like any kind of preparations like Vilepi, Yusha, those all come under Kritan. That can be given. Charaka hitters, Kshira Sarpi, Sushruta has not mentioned anything in the fifth month. Haritha has mentioned Pious. Charaka on sixth month, Madura Aushada, Kshira Sarpi, Sushruta, Gokshura Sarpi, Haritha, Madura Dhati. Charaka, Madura Aushadi, Kshira Sarpi again on sixth and seventh month, same diet. Sushruta has mentioned Pratak Parani Sarpi, and Haritha has mentioned Gruta Prayoga. Gruta Kanda has to be given. Charaka on the eighth month, Kshira Yavago, Sushrita has not mentioned. Haritha, Gruta and Puraka. So this has to be given. So eighth month, Vagpata has told that along with Ahara Dravyas, other modalities or other procedure also followed. Shushka Mulaka Kashayena Astapan Basti has to be given on the eighth month, told by Vagpata. Whereas Sushrita he has told Badara Udakena Astapana Basti. And Shatvadi Anuvasana Basti. Ninth month, Snigdha Mamsa Rasa Odana, Bahu Sneha Yavagu, Anuvasana, Pichu, Garbini, Pichu. And Garbini should wear Trivrit Mani in Shroni. So these has to be followed on the ninth one. This is a very unique. Snigdha Mamsarasa Udana, Bahu Snehayavagu, Anuvasana and Pichu Dharana should be done. And Garbini should wear Trivrut Mani in the Shroni. So these are considered as Garbhastapana Dravyas. That is Aindri, Brahmi, Vacha, which has been told in Charaka, Shadvirechana, Shatashriya, Garbhastapaka Kashayas that you can refer. So those are Aindri, Brahmi, Vacha, etc. So that. And no Panchakarma should be performed on 8th month. Instead of, if you are planning for a Vamana, you can go for Nistivana, a mild form of just spitting out, such kind of procedure. Instead of Virechana, Phalavartis are mentioned. This is according to Chakrapani. Now coming to Garbha Upadrava, he has told 8 in number. Haritha has mentioned 8 Garbha Upadrava. Those are Shosha, Hrillasa, Chardi, Shofa, Jvara, Aruchi, Atisara, Vaivaranata. So these are considered as the Upadrava of the Garbha. Diseases of Garbhini, Kashyapa has mentioned. On the fourth month, due to Vata Roga is there. Usually, Vata Roga happens on the fourth month of the Garbhini to Garbhini. So during that, Eranda Patra with Kshira can be given for Vata Hara. On fifth month, Vyakta Amlata Lavana. If there is a sore belching or there is a lavana or amla asyata, such condition is there, then you should go for astapana and madhura anuvasana basti. On sixth month, granthi, pidaka, shofa, rohini, vidhrati, daruna, shastra and kshara. This are contraindicated. This is going to happen, and even that time, the shastra prayoga, kshara prayoga has to be contraindicated, should not be done. Seventh month, Pina Mamsa, Pina Mamsa Upashamana, then Kshara Agni, Bhagna, Vishleshana, Shastra Karma. So these are contraindicated. Bhagna, there is chances of getting fracture, and Vishleshana. Vishleshana means there will be loosening of the joints. Garbidi Vamana. Garbini Vamana, like emesis or hyperemesis gravidum. If there is a vomiting or morning sickness in the Garbini, why it happens? He has told that because of Dau Hridaya it is going to happen. Another one is Vata, Kopa, and Garbha Nimitta. It is just because of Garbha. Garbha is only the reason for the Garbini Vamana. And what are the treatment for Garbini Vamana? Pito, Bonimba, Kalka with Shakkara. So, Bonimba, Kalka along with Shakkara should be given for drinking. It is mentioned by Harita. Shunti, Bilva, Kwata with Yava, Saktu. Yava Saktu is prepared where Shunti and Bilva is added. Kustumbara, Kalka with Tandulodaka. Sorry, Tandulodaka is you are soaking the rice grain in the water overnight. That is called as Tandulodaka. That has to be given along with Kustumbara Kalkaha. Bilva, Majja, then Laja Ambu. That is a combination mentioned by Yogaratnakara. Matulunga Rasa can be given. Amra Jantu Pravani. That is mentioned by Kashyapa. Now coming to Kikkisa. So what is Kikkisa? It is nothing but there will be itching over the abdomen. Why it is going to happen? Because of the enlarged abdomen, because of the gravid uterus, there will be stretching of the skin. Okay, there linea alba will be there. Means there is a white stretch lines will be there. Since there is a stretching, the lady will feel like itching. That is called as Kikkisa. Dosham Hridayashritam. Here, Ashtanga Hridaya is telling that when the dosha takes the ashra in the Hridaya, Kikkisa is going to form. Urasthita dosha. Dosha present in the Urasthana is responsible for Kikkisa. Usually in the 7th month, it is caused due to Vata, Pitta, Kapha. Both Tridosha Janya. So Kikkisa is in the 7th month. It is getting. Okay. Main clinical feature is Kandu and Vidaha. Kandu is itching, Vidaha burning sensation will be there. So management is Navanitam Hitam Tatraha. So application of Navanita is considered as the best. Kolabu, Madura Aushadhi, then Panitalam, and Ura and Stana Mardana, then Chandana Ushira Kalka Lepa can be done. Yena Harina Shashashonita with Triphala for application. Yena, deers, and Yena is again type of deer, antelope. Harina is the deer. Then Shasha, rabbit. Those blood mixed along with the Triphala has to be applied over the gravid abdomen or gravid uterus enlarged abdomen. Karavira Patra Siddha Tailabhyanga and Varja. What is happening? Kandu. So, Kandu Yanam Varjayet. Especially the itching has to be avoided. So, that is also one of the treatment. Alpa Sneha Lavana and Alpodaka Anupana. So, less water intake and Alpa Sneha and Lavana should be given or she has to consume. Uh, Garbini Jwara. So, these are the diseases specially manifest at the time of gestation. One is Garbini Jwara, Kashtavyadhi as told by Kashyapa. So before 4th month, no medication should be given, just 1 day Upavasa and Peyadi Karma. After 4 months, Lekana Aushadhis can be given. Udavartam. Udavarta happens to Garbini in the 8th month. Hanyat Garbam Sahi Garbinihi. So that is the shloka for the Udavartaha. Snehai Ashu Ashutaram Jayet. So it has been told, Udavarta, we all know, Urdhva Gaman of the Vata will be there. So Sneha Prayoga will give a quick relief. So Sneha Basti has to be given. Charaka has told Astapana Basti. And Sayam in the evening, Madhuka Siddha Tailena Anuvasana Basti. So Charaka has told Astapana Basti should be given in the morning, and in the evening, in the Sayam, Madhuka Siddha Tailena Anuvasana Basti should be given. Garbhini Atisara, in that Kalyana Avaleha, Gulma is indicated. Fourth month, Vata Gulmasya Chikitsa. Here, Gulma Chikitsa has to be given. Just remember, it's a very unique, and it is not Atisaravat Chikitsa, whereas Gulma, Vata Gulmashya Chikitsa is given. Akshepaka and Apatanaka. Akshepaka is again any kind of seizures. You can consider as eclampsia, pre-eclampsia state. Okay. In this Matulunga Rasa with Bida Saindava has to be given. Agni Mandaha Niruha. If Agni Mandya is the Niruha with Varuna Kvata. This has been mentioned by Acharya Kashyapa. In Kamala, Pippali, Ankola, Vaji, Leader, Rasa Vitada, Mahisha Dadi. It is given in Kamala in the Garbhini. Shofa. Vashabhu Vitada, Badara, Daru Kwata, Kashyapa as mentioned. Prishniparni, Bala, and Vasa by Yoga Ratnakara. Svedana with the hot water by Harita. Shofa. If there is edema, pedal edema or any kind of edema are there, this treatment has to be given. Jataharini, there are totally 35 in number. Among 35, 11 are considered as Sadhya, 16 are considered as Yapya, and 8 are considered as Asadhya. So now coming to Garbhaja Gada. Okay, so Garbhaja Gada means specially for the Garbha. Here Garbhini Roga we will learn. Now coming to the Garbha. What are the Rogas usually comes to the Garbha? There are 18 number told by Sharangadara. That is Upavishtakam, Nagodara, Makkalla, Moodagarbha, Vishkamba, Gudagarbha, Jarayudosha, and Garbhapata. So these are the 8 Garbhaja Gada. Now coming to Garbha Shosha or Vatabhipanna Garbhaha. It has been told by Sushruta. So Garbha Shosha, as the name tells that there will be retardation. Okay, there will be severe retardation of the fetus. Intrauterine growth retardation will be there. So what here the treatment is Sita, Kashmarya, Madhuka, Rasa Payas. This milk has to be given. Now coming to the Upavishtaka. Upavishtaka is a mild type of IUGR, that is intrauterine growth retardation. Here, Sanjata Sharire, no development, prolonged intrauterine stay will be there. So these are the 3 Lakshana told by the Charaka. Whereas Sushruta, he has told there will be no development. Ashtanga Hridaya has also opined that no development, and also no development of Kukshi, means there will be no development of the uterus, and there will be no development of Kukshi, but Spurana, pulsation will be there. These are the Lakshana of the Upavishtaka. Now coming to Nagodara or Upashushka. Nagodara or Upashushka, it is a moderate IUGR. Shoka, Upavasa, Ruksha or Yoni Srava. These are the main Nidana for the Nagodara or Upashushka. No development, prolonged intrauterine stay, and here no spandana. Whereas in Upavishtaka, there spandana will be there. Whereas in Nagodara Upashushka, no spandana will be there. No Kukshi development. There will be no development of the uterus, as well as there will be no pulsation. Nagodara, according to Charaka, or Naigamesha Graha, according to Sushruta. Chirat Kinchit Spandan. Means after a long duration, there will be a short time for a pulsation can be appreciated. Vruddha apihi parihiyatehi. So means there will be no proper development. Even if development is also there, there's a chance of death of the baby. Now coming to Upavishtaka. See, Upavishtaka and Nagodara, it has been told together by Charaka, and he has told that it is of three types: Vataja, Pittaja, and Kafaja. And then Upashushkam, it is told by Ashtanga Sangrakara. Here treatment Brahmana, Vatagna, Madhura Dravya, Grita Kshira Rasa, Amagarbha Bhakshana. Means if there is a death of the child. In the Upavishtaka, usually the Vata Pitta Kapahara treatment has to be done even in spite of treating. If ama garbha is there, then you have to uh, remove the garbha. Okay, then you have to perform the abortion. Then yana, vahana, kshobana. Okay, here it is ama garbha bhakshana means the one which is responsible for removing the fetus has to be given. Then after that, the lady is made to sit on the yana and kshobana. Now coming to Leena Garbha. Liyate nisprishyate means it will be leena. There will be no growth of the uterus and there will be no pulsation or any kind of movement. Treatment meat soup, yena, utkrosha, barhi, go matsya. Such kind of meat has to be given. Masha mulaka rasa and medhya mamsa and kati abhyanga. This has to be performed in leena karpa. Garbhasrava and Garbhapata. So there is a difference between Garbhasrava and Pata. What is Garbhasrava? If it happens, means the miscarriage happens, it is termed as Garbhasrava, especially in the month of first, second, third, fourth month. If it happens, then that is called as Srava, fifth or sixth month. If it happens, then it is called as Pata. This is according to Charaka, sorry, Sushruta. Whereas Charaka and Vagbata, he has told Srava is up to third month. Above third month is considered as Pata. Nidana. Arunadatta has told because of apatya sevana is the nidana for garbhasrava or garbhapata. Then vimshati yoni roga. Okay, 20 types of yoni roga. It is a reason for garbhasrava, garbhapata by bhela. Vatadi dushita. Here vata or vatakara ahara vihara is responsible for this condition as mentioned by Harita or the prayog of garbhapatana dravyas. Okay, by using the abortifacient drugs. It is told by Bhava Prakasha. Garbhapata Lakshana. So if Garbhapata is happening or abortion is happening, what Lakshana the Garbhini is going to express? Garbhashaya Kati Vankshana Vasti Shula. Though there will be pain in the Garbhashaya Kati back, Vankshana in the inguinal region and in Basti Pradesha, Shula will be there. Rakta Darshana means there will be Darshana, bleeding from the uterus, Parvajanal bleeding. This Lakshanas has been told by Sushruta. This you can understand as threatened abortion. Prasramsamana Garbha Lakshana. Prasramsamana means if the Srava means the abortion is happening, what Lakshana the female is going to express. Sadaha Prasava Prushtashula. Sorry, Pashva Prushtashula. Along with burning sensation, there will be pain in the Pashva and Prushta on the flank and the back region. Ashrupdhara, bleeding will be there. Anaha, distension. Mutra Sangha, retention of the urine. It is inevitable. Okay, you can consider spontaneous abortion. If this is coming, you can consider spontaneous abortion. Whereas threatened abortion means there is a every chance of restoring. But this spontaneous abortion is there, then it is inevitable. You can there is no any treatment. For Garbhapata Pratishedana, for the treatment of Garbhapata, then Varana Bandha before 8th month has to be done. This has been told by Kashyapa. Matyangi, uh, Matangi Vidya by Kashyapa, he has told. Garbhapata, Srava, Upadrava. The Garbhapata or Srava Upadrava are Shofa, Apatantraka or Ashes. So the treatment, first 3 months, Pratyakeya Chikitsa. That means Virudopakrama Chikitsa has to be done. If a Srava, first 3 months, Srava is happening, then before the expulsion, what you are supposed to do? Uh, Upavasa, fasting should be given. Shita, Ruksha, Rukshopa Samhita. Shita and Ruksha Ahara Prayoga. Then Ghana, Ushira, Guduchi, Aralu, Dhanyaka. All these dravyas can be used. It is for Srava. If Garbhapata is there, before the expulsion, Snigdha Shita, Ambuja Himakshira, Valkala Kalka, Ajya Lepitam. So Ambuja is the lotus, a type of belongs to Liliaceae, that the Himakshira has to be given, and Panchavalkala Kalka mixed with the Ajya, that Lepa has to be done. Ardra Pichu Yoni Dharana has to be done. Shatadauta Grita, by using this Grita, either you should perform Abhyanga as well as Avagaha. Lead for the licking purpose, Kshira Grita, a Shrungataka, Kasheruka, that has to be given. For Kadik, for the eating purpose, you should give Shrungataka or Kasheruka. For Pipet, for drinking purpose, Kanta, Abja, Shaluki, Bala, Udumbara with fire. All these drugs for the purpose of drinking can be given. This modality has to be followed before expulsion. After expulsion, Tikshna Madhya, Garbha Koshta Shuddhi, Arati, Vismaranya, Lagu Panchamula, Rukshapeya. Okay. Garbha Koshta Shuddhi. So you have to clean the Garbha, then Vismarana has to be given. Means something very surprising thing has to be given. Then Lagu Panchamula Rukshapeya has to be given. Madhyapana, Pancha Kaulika Sadhita Peya, then Taila Udhalaka Tandulai. All this can be given. Then Mashatulya Dina Peyadi Kama. Means on the in Garbhini Paricharya, what Masa the protocol has been told, Paricharya has been told, same has to be done on the day wise, on the first day. On the first month, what Paricharya, that has to be done the first day, second day. Like that, it has to be done. After completion of 9 months, in respect to the days, on 9 days, on the 10th day, Snehana has to be given. In a threatened abortion, Ishad Avanat Shirashkam. So it has been told by Charaka, Ishad Avanta Shirshakam. Avanta Shirshakam is on the when there is a threatened abortion, it has been initiated. So what you are supposed to do is like you have to raise the leg side of the person, lady. You should make the lady to sleep on the supine position on the feet head, okay, on the leg side, on the head of the leg, that has to be raised. On the head side, it has to be looped. That position you are supposed to make the lady to lie. Month wise, abortion preventing drugs. It has been told by Ashtanga Hridaya. On the first month, Madhuka Shaka Bija, second month, Ashmantaka, Krishna Tailaha, Vrikshadini Payasa in the third month, Ananta Sariva on the fourth month, Bruhat Dvaya Kashmarya on fifth month, on sixth month, Prishni Parni Bala Prayoga has to be done, seventh Shrungataka, Kapitta Bilwa on the eighth month, ninth one Sariva Ananta, now 10th month, Yashti Madhu has to be given. So these are the drugs. By administering, it prevents the abortion in a lady. गर्भपात प्रतिषेधनार्थं प्रजा वर्ण बंध. It has been told by Kashyapa. Now coming to the Rakta Gulma. Kashyapa has told that this is not going to happen in the female because tad ashaya asyaha cha abhavat purushanam cha na jayate. Because of the ashaya abhava in the purusha, Rakta Chagulma is not happening. Usually, Rakta Chagulma happens only in the Stri, Vataja, Pittaja, Kafaja, and Nichya Gulma. This four type of Gulma, it can happen in the both the gender. Whereas Rakta Chagulma, it happens only in the Stri. For that, Kashyapa he tells that Ashayasya cha abhava of the Ashaya, that is why it is not going to happen in the Purusha. This quote is from the Kashyapa. Why this shlokas have been quoting is like, even in competitive exam, they might give tad ashayaschaha abhavaha purushanam cha na jayate. So this is quote, this shloka represents for which disease? So such kind of question can be asked. Nidana, no food in Ritukala. That is, what are the causes for Raktachagulma? Doing Langana, especially in the Ritukala, Bayaha, Virukshanava Chikitsa, Vega Nigraha, some Stambhavat Chikitsa. Stambhanavat drugs have been taken. Ullekana, we all know, especially in the Ritukala, Vamana is contraindicated. If we are performing, that will lead to Raktachakulma and Ayoni Dosha. These are the Nidana for the Raktachakulma. Whereas Kashyapa has said, Bahumaituna Anbaksha Garbha Kama. Means if a Garbini is indulging in the Maituna, Bahu Shita Artavaha. If Artava is arguing, if there is too much of Shitatva, it will lead to Raktachakulma. Clinical feature, all Garbhini Lakshana will be there, Dhaurudya, Stanya, Pandutva, that is anemia, Vriddhi, that is the Kukshi Vriddhi will be there, gravid uterus will be there, are seen. Treatment is only after the 10th month. Before 10th month, if treatment done, it will cause bleeding. It is told by Chakrapani. Usually you should wait for 10th month. If you are doing a treatment before 10th month, it will cause bleeding. Samyak Pachana is told by Dallana. Snehana, Svedana, Sneha Virechana, Samyak Pachana is a Chikitsa told by Dallana. Then Snehana, Svedana, Sneha Virechana. This all has been told by Charaka and Vagvata. Sushruta has told Rakta Mokshana. Kashyapa has told where Rakta Mokshana, the Siraveda has to be done. It is Bahu Madhye Siraveda has to be performed. To induce bleeding, Palasha Kshara Siddha Sarpi Prayoga, Tilakwata, Lashuna, Madira, and Tikshna Madhya Prayoga has to be done. If a pain, Kalyanaka and Panagavya. It's been told by Kashyapa. Kulatva, Yushaha, Samskrita, Tribrit. That has to be given if pain is there. Vaginal tampons like Yavakshara Yuktaha, Palala with Sudha, Kshira, or with Katumatsya, Pitta Basti has to be given. Then Raktaja Gulma, Bedana, if no bleeding, then only after 10 months you have to incise and you have to remove the tumor. Period of normal labor, it is told that first day of the 9th month to 10th month. This is a period usually the labor begins first day of the 9th month till the 10th month. This is according to Charaka and Kashyapa. 9th to 12th month. Uh, you have to see the month. 9 to 10 is Charaka Kashyapa, whereas 9 to 12, both Vagbata, Ashtanga Hridaya and Sangraha, Sushruta, Bhava Prakash and Yoga Ratnaka all have opined that in between 9th and 12th month, the labor happens. Causes of onset of labor, Nadi Bandhana Mukti means there is a detachment of the placenta is there. That is the reason for the labor. Swabhava, naturally it happens. Then Kala Parinama, due to the Parinama of the Kala, because of 9th month, attaining 9th month, 10th month or 12th month. Arita hitas Garbha Vasa Vairagya, because the fetus has got bored staying in the uterus. Because of that, the labor is happening. This is being told by Harita. Whereas Bela hitas Gata Sampurnata means the fetus has been completely developed. So when the completely it is developed, that is the time the labor happens. So stages of labor, this is important. They have divided like beginning of the first stage. It is called as Prajayini. This has been told by Sushruta. Beginning of the first stage. The first stage is called as Prajanana Kalaha Abhimataha, has been told by Charaka. Asanna Prasava by Bhagavata. That is the first stage. There is a difference between beginning of first stage is called as Prajayini. First stage is called as Prajanana Kalaha Abhimata or Asanna Prasava. Beginning of the second stage it is called as Upastita Prasava. Second stage it is called as Parivartita Garbha. Third stage is Aparapatan. Apara is the name for placenta. True labor pain is called as Avi. Bearing down, it is Pravahana. Grahi Shula. Okay, this two is, term is important. Okay. Prajayini, here what happens on this stage? You have seen that Prajayini is the beginning of the first stage. Okay, here Kukshi Shitilata, there will be loosening of the Kukshi will be there. Mukta Hridaya Bandhana, there will be detachment of the Bandhana. Okay, Shula in the Janga, pain in the Janga Pradesha will be there. Means in the inguinal region or sorry, in the calf region, you will get the pain. Prajanana Abhimata, that is a first stage. There, Ghatra Klama will be there, Kukshi Shitilata, Kukshi Avasramsana. Means there will be again loosenings will be there. Yonehe Prasavan Tena Avihi. There will be Prasava Tena Avihi. Prasava means there will be bearing down will be there and Avi labor. The true labor pain starts. Then Udaka Parisheka. Praseka means there will be rupturing of the membrane and the amniotic fluid will be coming out. Then coming to the Asanna Prasava. Asanna Prasava, this is according to the Vagbata, even that is the first stage. Kukshi, Shlatata, Akshi Shlatata, Klama, Glani, Ado Bhurutva, Aruchi, Parisheka, Bahumutrata, Yuni, Bheda, Ruja. So these are all seen. Avinam Janma. Here, Avi means there will be Janma means there will be starting of the true labor. Avinam Janmaha. Garbhodaka Sruti. Sruti means there will be passing of the amniotic fluid, means the rupture of the membrane. Amniotic membrane rupture will be there and the amniotic fluid is starts to leak out. Upastita Prasava. So Upastita Prasava, it is the beginning of the second stage. Pain to Kati and Krishna will be there. Purisha Pravrati, even the patient will feel like defecating. Mutra Prasrichate means there will be without the control, there will be Mutra Pravrati will be there. Yoni Mukhe Shleshma. Yoni Mukhe Shleshma means there will be some kind of discharge from the Yoni Mukha. mechanism of the labor, Charaka has told that the lady has to sit on the floor. Then pravahana, you all know, it's a bearing down she has to do. Then she is made to lie on the labor cot. Then again pravahana, karane mantraha. You have to chant the mantra in the ears of the lady. Sushrutaha Kumara Parivartam. Okay, there will be Parivartam is there is a turning of the baby. Punnama Phala Hastam. Ushnodaka Parishekam. Okay, you have to do even Ushnodaka Parisheka. You have to keep the fruit in the hand, like auspicious fruit on the hand. You should give to the lady. Akantam Yavagu Payet, and you should make the lady to drink Yavagu till the Akanta. First, Bahu Shayana with the dorsal position. Okay, first she has to sleep on the prone position. Then the 4 female attendants should help in the Pravahana, that is in the third stage. Anagata Avi Pravahana. If it is there, then you have to make her to Shvasa, Kasa, Shosha, Pliha will be there. Shvasa, Kasa, Shosha, Bhadira, Muka, Vyatahanu, Murda, Abhighata, Vikata. Okay, so these are told by Sushruta. Means Anagata Avi. If a true labor is not there, Anagata Avi and Pravahana, if both are also not coming, so then it will lead to these conditions like Shwasa, Kasa, Shosha. All have told Shwasa, Kasa, and Shosha and Kubjata. So all these are going to happen. Dupayet Garbaha Sanjayatuhu Krishna Ahi Kanchukaihi. So you have to do the dhupana of the garbha for the purpose of bringing the labor. Riyanam pushni moolanam panipada dharanam. Pushpi moolaha. This drug has to be applied for both the palms and soles of the lady. For the pregnant woman, for the purpose of the labor. Suvarchalam Vaishalamba. Even you can make use of Suvarchala. Mechanical, Kadin, Akadayet. You should give something which is hard to bite. Such has to be given for the lady. Okay, then even Svijoho Ghadam Nipidayet. Okay, then you should, with the pressure, you are supposed to press the uterus. Then Dhalu Kantaha Sprishayet. You have to touch the uvula of the throat. Means to induce the gag reflex. When gag reflex it increases the intrauterine pressure. Venu is the this lotus stalk should be used. Murdni Snuhi Paya Dhupana. The Murdni Bhaga, I should give a Snuhi Paya Dhupana in the labor. Burja Langali Kalka. You all know Langali, it induces the labor. Okay. Kushtataleshu Kalka Inadi Suramandasa Sneha Lavanaha Niruha Basti should be there. Then you should extract with the hand. As per Kashyapa, the term Sutika cannot be considered for a lady unless she has not labored. Okay, unless she has not expelled the apara, she is not supposed to consider as Sutika. So this Dhupayet Garbaha, this is to remove the apara. Okay. Now coming to the complication of retention of the placenta. Ana and Admana will be there. Akala Prasava. It is coined by Aruna Datta. Another term is Vipra Srava. Achira Jata, as being told by Charaka. Apurna Divasa Prasava. So these are the terms used for a labor of a long duration. Or Vilambita Prasava has been told by Bhava Prakash and Yoganatthaka. Now comes the Mrita Garbha or Garbha Shalya. Mrita Garbha means the fetus has been dead itself in the uterus. So how you are supposed to manage the Mrita Garbha? Here is telling why Mrita Garbha is going to happen. It is Daivota. Because of the Daiva, it can be causing. Main dosha is Vata. Clinical feature is abdomen Shaitila. There is a loosening of the abdomen. If you will not palpate hard, it will be very soft. Stabdam, even on contradictory, I have told there will be stabda, means there will be no movement. Okay. Sheetam, when we touch, it will be cold. When we palpate, it will be cold. Ashma, antaha, gatam iva, as though the stone has been kept inside the uterus, like that, or in the abdomen, like that feeling will be there. Fetus, absence of FHS, that is spandana will be there. Fetal heart sound will be absent. Pain, true labor pain subside. Avina Prashamana. In a lady, Akshi, Shastra and Uchvasaha Putita. Means there will be partial closing of the eyes and drowsiness will be seen and increased Shvasa, breathing will be there. Treatment, Aparasanga Chikitsa. So this is the treatment of a aparasanga, retained placenta. The same chikitsa has to be followed. That is the first step. Then Atharva Veda mantra, chanting of the hymns of the Atharva Veda. Then Shalya, Harata, and Harana. You have to use the Shalya extraction by an Harana, by experienced surgeon. Now coming to the Muda Garbha. Muda Garbha is nothing but obstructed labor. Okay, obstructed labor, Viguna, Apana, Sammohita, Muda Garbha, Chakshate. If there is Viguna, Apana, Vayu is there, that causes the Muda Garbha. Muda Garbha means obstructed labor, like there will be not naturally the labor process happen. Why? Because of the position that we are going to learn. Dalhana happens, this usually happens after 4th month or after 7th month. Madhukosha, Uchita, Prasava Kala. If there is a long duration of Prasava Kala is there, that is responsible for Muda Garbha. 4 types. It has been accepted by all, but whereas Harita has accepted 7, Vata, Pitta, Dvandaja and Sannipatika. So these are the types. So common clinical feature is Yoni Jataradishu Shula. There will be pain in the Yoni and Jatara Pradesha in Mutra Sangha. This Lakshana has been told by Madhavanidana. So, 4 positions are there. Keelam, Parigraham, Bijakam, Parigam. Keelam. Keelam means it resembles like a nail. Urdhva, Bahu, Shira, Padayoho. Means the breech position will be there and along with the both the legs will be extended. Okay. So that is called as complete breech. Pratigram. Nisrutahastapadaha shiraha kayehe sangihi. It is extracted flexion in the transverse line. Okay. In the transverse way, the baby will be lying. Bijakam. Nirgachati ekashiro bhujaha. Means there will be, when we see first, it will be in the vertex, but along with the head, one hand, one extremity will be there. That is called as a compound presentation. Parigam is a completely transverse line. Asadhya Lakshana is Garbha Kosha Sangha. If there is a Sangha is there, then Makkala is there, then Yoni Samvarana is seen. Treatment for Mrita Garbha. Jarayu Patana Mantra. Even for Mrita Garbha also, the same treatment is given. Koshna Ambu Sechana. Then a treatment procedures like dilation with the Purana by Guda, Kimva, and Lavana. By this, you are supposed to dilate the uterus. Slimy. For example, Sharmali picture. It has to be smeared. It acts like a glove. Atasi picture kalka. Even atasi flax seeds. Even when it is soaked in the water, even it becomes slimy. With gruta purana, you're supposed to uh, cover both the hands, and with that you should extract it. Okay, Langali Mula Lepa is advised. Again, it is abortifacient. Most difficult surgery in the Ayurveda. The Mrita Garbha surgery is considered as the most difficult. Okay, surgical extraction, that is अक्रियम् ध्रुवं मरणानाम् उपकरणेः संशयः. If akriya, if it is left like that, then it is going to lead to death. So that is why you should start the Shalya karma as soon as possible. Lithotomy position, Vastra Chumbalaha Unmattihi Katihi, means you have to tie the vastra around the Kati Pradeshaha. Harith advises to introduce the Tarjani and Angusta and hold the neck of the baby and extract it. Mechanical extractions like Achanna, Pidana, Sampidana, Vikshepana, and Ulkshepana. So these are the way of extracting the baby. So, destructive operations, that means if you cannot wholly extract the baby, you can cut the parts and then you can extract. That is called as destructive. Chedana with the mandalagra, no vriddhi patra should be used. Then craniotomy, hold with the garbhashanka, then this craniotomy is done. Okay, cutting of the crane. Amsa shaktaha cleidotomy, means cutting of the both the hamsa. Udara saktaha, ever say evisceration. Okay, after surgical, this destructive operation is done. Then after surgical, 3 to 7 days medicine should be given. Then Gruta plus Asava Pana has to be given up to 10 days. Milk with Vatahara Dravyas for 10 days. Next 10 days, Rasa. So totally 30 days. So first 3, 5, 7. It's a odd days. There only medicine should be given. Okay. Grita and Asava Prayoga has to be done on 10th day. Then totally it becomes 10 days. Then hold next 10 days. Milk with Vatara Dravyas. Okay, next after 20th day, Rasa. So totally it becomes 30 days. Then Patya Bhojana for another 3 months. So she should be on Patya Bhojana for the 3 months. This is the post care of a Mudagarbha. So totally 4 months Patya Kala. Important medicines like Bala Taila, Dhanvantari Taila, Sutika Bala, Marmasti, Hastaha, Kshineshu Pujitam. So those are all indicated. 6 months use will cure Antar Vriddhi. Antra Vriddhi is going to reduce. Okay. Kashyapa describes a Bala Taila for Dhatri. We all have seen that this Bala Taila even for the Dhatri he has mentioned. Kukshipatana. Caesarean section has also been mentioned. Here, the Kukshipatana indication is if the mother is dead and the baby is alive, then alone Kukshipatana is done. Should be completed within the period of 2 Katika. So, if Kukshipatana is performing after the death of the mother within a 2 Katika, that is in one Muhurta Kala, they are supposed to perform the Kukshipatana. So, this finishes the Prasuti Tantra. Have dealt the important point. Okay, so this is the most important. Rest are also there. Since it's a crash course, I'll be giving more stress on the important point. Okay, and while discussing the questions, even we can discuss the questions which have been not dealt in the theory classes. Okay, this finishes the Prasuti. Tomorrow we shall deal with Stri Loka. So thank you.